Hi everyone, I'm Deborah Calendar, physiotherapist and dementia care specialist. Today we're talking about a very important topic, red flags in dementia care, knowing when it's time to see the doctor. Because sometimes what looks like the dementia getting worse is actually something that is treatable and in fact urgent. When someone living with dementia suddenly changes, for example, they're more confused or weak or just off in their behavior, it's often a sign of something else going on. It could be an infection, dehydration, pain, or a reaction to medication. Let's go through several key red flags that you should never ignore. Sudden confusion. If your loved one becomes much more confused than usual over a few hours or a day, that is a big warning sign. Fever or chills. If they're feeling hot, shivering, or complaining of being cold when the room is warm, this may signal an infection. Urinary changes. If they complain of pain or burning when passing urine, if they're going to the bathroom very often, or if there's new incontinence, it could signal a urinary tract infection. Another very big sign is when the urine is cloudy, or dark or foul smelling, or all three. New falls or weakness. If they're suddenly losing balance, suddenly unable to stand, or the legs are giving way, it might be time to call the GP. If they are crying out, guarding an area, grimacing, or refusing to move or to move the particular area that they're guarding, these are signs of pain. And of course, not eating or drinking, if they're skipping food or fluids all day long or not passing urine for many hours, this is never normal. Pain often shows up in ways that aren't obvious, especially when someone has difficulty communicating. Here are a few quick checks you can use. You can use a faces scale where you show a picture of faces from smiling to hurting and ask which face shows how you feel. You can ask them to point, say, show me where it hurts, and gently touch different areas and watch their reaction. You can watch their body language. Signs like guarding, grimacing, moaning, or refusing to move often mean pain. Even if they can't tell you, their body usually does. When it's time to call the GP, being prepared helps the doctor understand what's happening. Write down these simple details before you make the call. 1. What has changed? Describe the new symptom. Is it confusion, pain, fever, or something else? 2. When did this symptom start? When did you first notice it? Did it come on suddenly or gradually? 3. Foods and fluids. Have they eaten or drunk anything today? 4. Temperature check. Take their temperature if you can. Normal is about 98.6 degrees Fahrenheit or 37 degrees Celsius. And 5. Medications. Have their medication list handy, including any recent changes or new prescription. Good notes make for better care. Sometimes the situation needs immediate attention. Call 911, an ambulance, or go straight to the emergency room if your loved one is very drowsy and hard to wake, complains of severe chest pain or pressure, is struggling to breathe or gasping for air, has blue lips or a blue face, or has a seizure or convulsion. And remember, please avoid these common mistakes. Don't wait days hoping that the symptom will pass on its own. Do not stop antibiotics that have been prescribed early. Prescribed antibiotics need to be taken to the end of their course. And do not use old prescriptions because you think you recognize the symptom without discussing it with the doctor. You can download the red flag checklist and GP notes templates to keep nearby to make it easy to spot danger signs and give clear information when you contact your doctor. You can find these in our Dementia Caribbean school community. The links will be in the description to this video and also in the bios on any one of my social media platforms. For deeper support, you can book a care planning consult by emailing dementiacaribbean@gmail.com, or you can WhatsApp me at 876-829-8200. Remember, acting early saves lives and prevents unnecessary hospitalizations and sufferings. This is Deborah Calendar. Thanks for listening and watching. Let's keep caring smart, calm, and informed for the people we love and for ourselves. Remember to like this video, to share it to another caregiver who may need it, and subscribe to this channel for further clips like this and more information. Thanks for watching.